from Chile, we go to India. Anuj Kumar from Legal Desire Media. Anuj, can you hear us?
Yes, can you hear me?
Yes, please go ahead.
Yeah, thank you for taking my question. So there is a complete lockdown in India as a day before. Prime Minister of India extended the deadlines till 3rd of May. So for the reason in lockdown, internet is a main source of information and socializing. A challenge is that a lot of COVID-19 fake news regarding medicines, treatment, origination stats is spreading across social media. So can you please elaborate on what measures have WHO taken with social media platform like Facebook, WhatsApp, Twitter to tackle such fake news, and search engine like Google to remove search listing of such pages with fake news?
So I could start, and perhaps Mike or Diti would like to supplement. We've been working with a large number of platforms, and Google and Facebook, and I'm gonna list them, but I'm gonna forget to name them all, with Viber and WhatsApp, to make sure that information that is put out is accurate information. We have been fighting this infodemic since the beginning. There's a lot of information that is out there that is inaccurate, and we're working very hard to ensure that when someone searches for COVID-19, that the first thing that comes up is a reliable source. And that would either be a WHO website or national websites, and so that you can find accurate information. And so when you search, you find the latest accurate information, because this is an evolving field. It is confusing out there because, unfortunately, sometimes the misinformation gets circulated more. So each of us has a responsibility that when we see something and we see something that is false, or we think something is false, we don't pass that on. That's our responsibility as well. But we're trying to ensure that we address the myths, we address the inaccuracies. We have something up called Mythbusters, where we hear about rumors, potentially rumors that could be damaging and harmful to health. We address those head on to make corrections, and we try to get that information out as quickly as possible to ensure that when you do a search, that all of the platforms will give you the reliable information first.
And if I can supplement, our EpiOne platform, our information network for epidemic, also provides direct access to many, many communities around the world, religious and faith-based communities, to working communities, to commercial communities, all over, in many, many places. And we have channels for each and every one of those areas in which there are webinars and there are interactive sessions in which we engage with civil society at all levels, all around the world. But I also just would like to say, because we never ever get a chance to do this, is to really thank our media and social media teams. They're the silent heroes of our response, and have engaged and understand that we don't go after the messenger. What we try to do is make sure that we replace bad information with good information, and that's as important in fighting a virus as any frontline health worker. So chapeau to our teams who do the silent work.
I just would like to add to that. India has actually a strong capacity to help in this. It can play a big role in fighting infodemic. And as Maria and Mike said, we're partnering with Google, Facebook, and others. And we would like to use this opportunity to act not only at the global level, but at the country level. But taking into account India's capacity will be really good. And as I said earlier, we would like to reach out to India directly using Hindi. Mujhe Hindi nahi aate, but at least we would be able to send messages and partner with India to fight the infodemic, which is actually causing lots of problems and blocking millions from getting the right information. So we call on India to partner with us, use this opportunity because of its capacity to fight infodemic, because it has a big capacity. Thank you.